Prostate cancer is the most commonly diagnosed cancer in men. It is often treated effectively with a radical prostatectomy. The side effects of this procedure and other management strategies can, however, be severely worrying. Men faced with this reality can benefit greatly from seeing a men's health physio. I have with me today an expert in the field of men's health. A physio is making a huge impact on the life of men who face pelvic health struggles. Pierre Roscher. Welcome, Pierre.
Thank you, Joe.
Okay, so tell us a bit about what is a men's health physio.
Perfect. So a men's health physio is a physiotherapist with a special interest in male conditions relating to the pelvis. It isn't exclusively only the pelvis. It may be other aspects such as mental health as well, but the focus is really on the pelvic girdle and the pelvic area and the organs contained within the pelvis. So it's a field that is very new. There's only a few of us in the country and in the world. In fact, it's a growing area of specialization or special interest within physios. But it's a very important field that has been neglected for many years. And hopefully there are more men's health physios being trained as we speak.
Yes, I do hope that it will grow as much as the other fields have grown recently. Okay, tell us a bit about what conditions are treated by men's health physio.
So the most common condition that we will see in our practice, especially here in South Africa, is male or men who've had prostate cancer, and specifically who've had treatment for prostate cancer. So we're talking about the guys who've had a radical prostatectomy, or the guys who've had brachytherapy or any other kind of radiation therapy. So the prostate cancer is quite a big part of it. Then we see a range of other conditions relating to sexual dysfunction without any prostate issues or prostate cancer. And those can range from young adults to older men. We also see other urological conditions related to the bladder. So any incontinence, any overactive bladder symptoms, things like that. So the urology conditions. And then, of course, there's the whole field of pain and pelvic pain, and specifically unresolved pelvic pain. And it's quite a taboo area. So a lot of physios do not go into the pelvis. So there's quite a large area of musculoskeletal conditions that can refer and give a person pain in their pelvis.
Wonderful, thanks. And tell us, with regard to prostate cancer specifically, what is the role of a men's health physio there?
So the role is, there's a few components of what we do. The first thing is we are well known for pelvic floor exercises, but that has really evolved over the last few years. And it's not just pelvic floor exercises, it's specific rehabilitation of the pelvic floor. So that is the main thing that we are known for treating related to prostate cancer. But our main role is actually education. So we want to educate these men on various aspects related to their disability when they have prostate cancer. So ideally, we want to see you a month before you have your prostatectomy, and we want to educate you on what you can expect and what's going to happen. And the incontinence that you probably will experience as a result of your prostatectomy, and to prepare you so that you can go and purchase the right products from your pharmacy, that you can wear the right clothing to avoid embarrassment if you may leak a bit of urine. And of course, we do start training or educating you on your pelvic floor a month before. And our evidence has shown us if you start working and exercising your pelvic floor for a month before you have your prostatectomy, your outcomes are much better. Then once you receive your prostatectomy, you have a catheter in for 7 to 10 days, depending on your surgeon. And the moment that catheter comes out, then we start with our rehabilitation, and we start by exercising your pelvic floor in very specific ways. The main thing that men will complain about after prostatectomy initially will be incontinence, so that's leaking of urine, and that can take a bit of time to settle down. So that is often our first focus with these men, is based around the incontinence. As they start to dry up, we focus more on sexual dysfunction. And what we often see is that the sexual dysfunction is completely neglected, as that takes a very long time to settle down, and there are very specific things that need to be addressed with regards to sexual dysfunction. So my patients with a prostatectomy, my approach is education, pelvic floor exercises, and to diminish their disability and to assist them with their recovery, not just in incontinence or leaking of urine, but also that long-term sexual dysfunction that we need to address. So that is our role in a nutshell for prostatectomy patients.